So what
Okay.
happens is from their history that they've been exposed, my patient population, they've been exposed to a
Hmm.
car accident, an assault, a slip and fall, chronic stress, blown up. My partner was blown up in his fourth tour of duty. And that put him onto a pathway 6 months later on 13 medications. His wife would tell me that she'd find him in the hall closet in a fetal position with his sidearm in his mouth. You know, that's not healthy. 3 months later, he's off all his medication. He ends up getting an MBA from Pepperdine in business. He ends up co-founding, and he and his brother write a book that gets made into the movie Quiet Explosions that was nominated for 2 Academy Awards. And it talks about the work that we've done. It's not about me. It is a part about him because he was one of the cases. So about how to reverse everything. Another issue with the inflammation is that this peroxynitrite is responsible for migraines. When we drop the level by giving them high dosing of things that will drop it, like vitamin D, DHEA, pregnenolone, progesterone, testosterone, making sure their thyroid's correct. What happens is you see them getting better and they get off their psychotropic medication, their medication for mood disorders and so forth, whatever they're on.
Yeah. So I'm just thinking, so a couple things. I'm thinking about these young patients that I see. I saw a gentleman today, he's 29, and he has a testosterone of 320. And, that's not normal, although the blood work says that's normal because anything from 200 to 1100 is normal. But if you're 29 years old, that's not normal. And his FSH is 2.7 and his LH is like 1.3. And he had a little bit of insulin resistance, like his insulin's 12. But going through his labs, it wasn't awful. And so I talked to him a lot about his gut, and he admitted to not having a great diet. But then, I mean, so that's screaming he's got inflammation in his brain from something. Now he's not,
Right.
that I know of, he doesn't have a traumatic brain injury. He hasn't been in the military.
Yeah. What is a
Hats off
traumatic brain
to
injury?
those people. But so something's going on with his brain. Yeah.
Yeah.
Like he's had some sort of, but it could
So,
be from his gut.
yeah,
Yes.
could be from the gut, which we all need to look at. But the question is, what is a traumatic brain injury? I mean,
Uh-huh.
how do you qualify someone as having a traumatic brain injury or not? What are the parameters that you need to have to be included into that category?
I have no idea. That's a great question for you.